Bismillahirrahmanirrahim. In the previous lecture, we discussed about mainly the hyperthyroidism, and now in this lecture, we will discuss about the hypothyroidism and the types of hypothyroidism, the clinical features, and the diagnosis. Now, first, what is the hypothyroidism? Hypothyroidism, it is a condition caused by structural or functional derangement. Structural or functional derangement that interferes with the production of thyroid hormone. So, the thyroid hormone, the level of thyroid hormone would be decreased due to structural and functional derangement. Okay, and it is the most common in women with the increasing age, most common in women with advanced age. What could be the cause? The etiology of the hypothyroidism, it could be a disorder at any level in the hypothalamic pituitary thyroid axis. There could be abnormality at the hypothalamic level or pituitary level or thyroid level. So the hypothalamic pituitary thyroid axis, this is mainly disturbed. Now there are two terms. The one is the primary hypothyroidism and the second is the secondary hypothyroidism. The primary hypothyroidism is caused due to the intrinsic abnormality mainly in the thyroid gland, whereas the secondary hypothyroidism, it is due to the disorder or any abnormality either at the level of hypothalamic or pituitary. Now we discuss mainly the types of the hypothyroidism. Sorry, there are mainly three types of hypothyroidism. What are those? The first is the congenital hypothyroidism. The second is the second cause could be the autoimmune hypothyroidism, and the third cause is iatrogenic, any therapy induced iatrogenic hypothyroidism. Now we discuss about the congenital hypothyroidism. The congenital hypothyroidism, it is usually due to the deficiency of iodine in the diet, due to the endemic iodine deficiency, due to endemic iodine deficiency in diet. So congenital hypothyroidism, it is usually common in hilly areas where the diet is deficient in iodine. The other causes of the congenital hypothyroidism could be the abnormality, inborn errors of thyroid metabolism, inborn errors of thyroid metabolism. In the thyroid hormone metabolism at any level, there could be the abnormality either in the uptake of iodine or in the organification of iodine or any level. So inborn errors of thyroid metabolism, which is also known as dyshomogenetic goiter. And the second cause, either the thyroid gland could be the absent, even thyroid gland could be absent at birth. This is known as thyroid agenesis. The thyroid gland is not formed, or the thyroid gland is reduced in size. This would be called as thyroid hypoplasia. So congenital hypothyroidism, it is due to the endemic iodine deficiency in diet. So it is congenital hypothyroidism is mainly common in hilly areas, and the other causes could be the inborn errors of thyroid metabolism, or there could be the thyroid agenesis, or there could be the thyroid hypoplasia. In these three conditions, there would also be the hypothyroidism and congenital hypothyroidism. Now we discuss about the autoimmune hypothyroidism. In the autoimmune hypothyroidism, the autoantibodies are formed against the thyroid antigen, and it is most common in the areas where the iodine deficiency is not common. So it is common in, you can say it is common in iodine sufficient areas of the world, where the congenital hypothyroidism has been controlled by supplementation of diet with iodine, but the at that places the autoimmune hypothyroidism is common, and the example is the Hashimoto thyroiditis. Hashimoto thyroiditis, there would be circulating autoantibodies would be present, and the thyroid gland would be enlarged, which is called as goiter. Now next is the iatrogenic hypothyroidism. The iatrogenic hypothyroidism is mainly the therapy induced, which is caused by the doctors. That, for example, there is radiation is given to the patients for the treatment of hyperthyroidism or any neoplasm of the thyroid gland, or the surgery is done for hyperthyroidism or any neoplasm of the thyroid gland, or the drugs are given like antithyroid glands for hyperthyroidism and neoplasm. So and secondarily the patient may suffer from the hypothyroidism, and this condition is called as iatrogenic hypothyroidism. Now we discuss the specific forms of hypothyroidism. The one is the cretinism. Cretinism is the hypothyroidism which is occurring in infancy or early childhood. That is, in infants, hypothyroidism which mainly develop in infants or early childhood. So cretinism, the main cause is due to, the cause of cretinism could be the iodine deficiency in diet, or there could be the dysharmogenetic disorder, that is inborn error of thyroid metabolism. Dysharmogenetic disorder. The clinical features, the cretinic patients, the cretinic childs, how they will present. Mainly two organ systems are affected in cretinism. The one is the CNS, central nervous system, and the second is skeletal system. In CNS, as central nervous system, so such a child would be suffering from the severe mental retardation. And skeletal system, the skeletal system would not properly form, so such child would be having the short stature. And the other features include coarse facial features, and this is due to the deposition of extracellular matrix in subcutaneous tissue, protruding tongue, enlarged tongue, and this is due to deposition of extracellular matrix in viscera like tongue, and the umbilical hernia. So child would also be suffering from umbilical hernia. So what is cretinism? It is basically the hypothyroidism which occur in infants or early childhood, and the cause could be iodine deficiency or dysharmogenetic disorder, that is the error in the thyroid metabolism. And the clinical features, what two main organ systems are affected. The first is the CNS, that such patients would be having the severe mental retardation, and the second is skeletal system, that such children would be having the short stature and they would be having the coarse facial features and protruding tongue and umbilical hernia. Now we generally discuss about the clinical features of the hypothyroidism. And what are the clinical features? How the patients of hypothyroidism they are going to present to us. Such patients they would be having the slowing of the physical and mental activities. Their physical and mental activities would be decreased. They would be having the generalized fatigue and depression like symptoms. Secondly, they would be having the cold intolerance. In hyperthyroidism, they would be heat intolerance, but in hypothyroidism, they would be having the cold intolerance. They would be overweight, and cold intolerance and overweight is due to the decreased metabolism due to thyroid hormone deficiency. Fourthly, they would be having the constipation and decreased sweating. This is due to the decreased sympathetic activity. Then these patients would be having the skin of such patients would be cold, clammy extremities, and pale looking skin and cold. And this is due to the decreased blood flow. Then these patients would be easily become short of breath and decrease oxygen exercise capacity. Short of breath and decrease exercise capacity. This is due to the reduced cardiac output. Then as we discussed previously that such patients would be having the broadening and coarsening of the facial features, enlarged tongue, and deepening of voice. And this is due to the deposition of extracellular matrix like glycosaminoglycans in the skin and subcutaneous tissue. That's all about the clinical features. I'm again repeating that the patients suffering from hypothyroidism, they would be having the decreased physical and mental activity. They would be having cold intolerance, they would be overweight, constipation, decreased sweating, skin would be cold and pale, and they would be short of breath, decreased exercise capacity, coarsening of facial features, enlarged tongue, and deepening of voice. Another term is used which is known as mixed edema. As we discussed previously, the term was cretinism, which was the hypothyroidism occurring in infants and childhood. What is the mixed edema? The mixed edema is the hypothyroidism which is occurring in adults and older children. Now we discuss about the diagnosis of hypothyroidism. Diagnosis of hypothyroidism depends upon two things. The one is the serum TSH level, the most important and the sensitive screening test for hypothyroidism, and second is the free thyroid hormone levels. The serum, because it is the hypothyroid conditions, the free thyroid hormone levels would be decreased, T3 and T4. So there's loss of the negative feedback inhibition. So the TSH level would be increased. That's all about the hypothyroidism. I'm again repeating for the diagnosis of hypothyroidism that serum TSH level would be raised while free thyroid hormone level would be decreased. That's all about the hypothyroidism. Thanks for joining.